On May 22nd, the House of Representatives passed one of the most consequential healthcare bills in decades by a single vote. And if you have Medicaid, Medicare, or ACA coverage, this bill could strip you of your insurance, and there's probably nothing you can do about it. I'm about to break down exactly how this affects your coverage, what changes are coming, and what you need to do to protect yourself. I'm Callie from NavaQuote, your licensed insurance broker and your guide through all things insurance. Today we're breaking down H.R.1, the One Big Beautiful Bill Act, and I'm going to show you exactly how Congress weaponized budget reconciliation to fundamentally restructure American healthcare and how this bill will impact your health insurance coverage. These changes will affect your premiums, your benefits, and your ability to get coverage. And I'll give you actionable steps to protect yourself and your family. First, let's understand what H.R.1 actually does to your insurance options, because the changes are massive and they affect almost everyone. This bill uses a special budget process that only needs 51 Senate votes, not the usual 60, and they're using it to completely reshape how Americans get their health insurance coverage. We're talking about changes that could affect over 13 million Americans across Medicaid, Medicare, and marketplace plans. These aren't small tweaks, these are fundamental changes to how health insurance works in America. Let's start with one of the biggest changes: mandatory work requirements for Medicaid expansion populations. If you're on Medicaid and you're between 19 and 64 and you don't have any dependents, this directly affects you. You'll need to work, volunteer, or be in training for 80 hours per month. That's 20 hours per week, every week, and if you miss those hours, you lose coverage and it's automatic. These requirements are tough to meet because based on data from states that have tried this before, many people struggle with irregular work schedules, seasonal employment gaps, documentation requirements, and reporting deadlines. The Congressional Budget Office projects 5.2 million people will lose Medicaid coverage just from work requirements. That's not political opinion, that's actuarial math based on real compliance rates. States have 12 months to implement these requirements, so if this big, beautiful bill act becomes law, expect work requirements to start rolling out by early 2026. Now let's talk Medicare changes, because if you're not a US citizen or a permanent resident, your Medicare access is about to change dramatically. Right now, many lawfully present immigrants can access Medicare after meeting standard requirements. H.R.1 will restrict Medicare to U.S. citizens, legal permanent residents, and a small group of Cuban nationals under specific migration agreements. This affects thousands of current Medicare beneficiaries who are lawfully present but not citizens or a permanent resident. We're talking about people who've been paying into Medicare for years through their payroll taxes. And here's the really aggressive part: current enrollees get reviewed as well, and if they don't meet the new requirements, they lose coverage after 1 year. This isn't just for new applicants, this is for existing beneficiaries as well. If you lose Medicare, your options become extremely limited because private insurance for seniors is expensive and often unavailable due to pre-existing conditions. The ACA marketplace changes might be the most dangerous for middle-class families because they turn your premium subsidies into potential debt traps. Right now, if you get too much premium tax credit during the year, your repayment at tax time is capped based on your income. Under H.R.1, there's no cap and you could owe thousands and thousands of dollars. Let me give you a real example. Let's say you're a family of 4 making about $60,000 a year and you get $800 per month in premium tax credits. But then you get a raise or a bonus that pushes your income a little bit higher, and under the current law, you might owe $1,500 max. Under H.R.1, you could owe the full $9,000 in tax credits that you received. The bill also requires annual income verification with immediate subsidy adjustments and no more year-end reconciliation. If your income goes up mid-year, your subsidies stop immediately. For immigrants, H.R.1 creates much stricter eligibility rules for premium tax credits. Many lawfully present immigrants who currently qualify will lose subsidy eligibility entirely. Even if you're lawfully present, you lose premium tax credit eligibility if you have asylum status, parole, temporary protected status, deferred action, or withholding of removal. We're talking about people who are here legally but in a temporary or pending status. This affects hundreds of thousands of people: asylum seekers with pending cases, recipients from other countries like Haiti or Venezuela, people with deferred action status. These are individuals who are working, paying taxes, but will lose access to affordable marketplace coverage. H.R.1 also eliminates safety net rules that helped lawfully present immigrants below 100% of the poverty level get their premium tax credits if they couldn't get Medicaid. That safety net is gone. Now here's where H.R.1 actually creates opportunities for insurance planning. The health savings account expansion is huge. Current HSA limits are $4,300 for individuals and $8,550 for families. H.R.1 adds an additional $4,300 to individual limits and $8,550 to family. We're talking about $8,600 for individuals and $17,100 for families, all tax deductible. And they're expanding who can have HSAs. You can now contribute to an HSA if you're 65 or older on Medicare Part A, you have a direct primary care arrangement that's under $150 a month, or you have a bronze or catastrophic marketplace plan. There's married couples over 55 can both contribute catch-up amounts to the same account. Plus, you can now roll money from FSAs and HRAs into HSAs, and married couples aren't penalized if one spouse has an FSA at work. H.R.1 also expands something called choice arrangements, which are basically a rebranded version of individual coverage HRAs, or ICHRAs, that some of you might already know about if you're familiar with ICHRAs. Choice arrangements work similarly. Employers give you money to buy individual insurance instead of your employer picking one group plan for everyone at your job. But H.R.1 makes some key changes and adds new incentives. Here's what's new. Small businesses now get a tax credit, $100 per employee per month in the first year, then $50 per month in the second year. This makes ICHRAs much more attractive for small employers who couldn't afford to offer benefits before. Another big change is employees can now use cafeteria plans like flexible spending accounts alongside that choice arrangement to buy marketplace coverage. This actually was not allowed with traditional ICHRAs. This expansion matters because it makes individual coverage viable for way more employers, and you still get to pick a plan that fits your needs instead of taking whatever your employer has chosen, and it's portable. So the plan still follows you when you change your job. Here's what you need to understand. When 13.7 million people lose coverage, they don't just disappear from the healthcare system altogether. They still get emergency care at hospitals, but now it's uncompensated care, and hospitals will have to eat those costs, and guess how they make up for it? They charge higher rates to insurance companies, and then those higher hospital rates get passed directly to you through higher insurance premiums. We saw this exact pattern in states that didn't expand Medicaid, and their individual market premiums were consistently higher. Rural areas get hit the hardest. Rural hospitals, already struggling financially, face potential closure when they lose Medicaid patients and gain more uncompensated care. Fewer hospitals means less competition and higher costs for everyone. So let me break down when you'll see all these changes because timing matters for your planning. For Medicaid work requirements, states have 12 months to implement after the bill becomes law. So you should expect these rollouts to start early 2026. Medicare citizenship requirements are as immediately for new applicants, and it has a 12-month grace period for current beneficiaries that are under review. As for the ACA changes, most of those take effect for plan year 2026, which means open enrollment in fall 2025 will be under the new rules. And those premium increases from cost shifting, these start immediately as hospitals begin absorbing more uncompensated care costs. HSA expansion and choice arrangements are available starting 2026, so you can start planning now. And choice arrangements for small businesses, like those tax credits, would start immediately, giving employers a new way to offer benefits. So here's your legal reality check. If H.R.1 becomes law, challenging it in court is probably futile. Congress used its strongest constitutional powers, and the Supreme Court's conservative majority isn't likely to second-guess congressional spending and immigration decisions. As an insurance broker, here's what I'm telling all of my clients personally to do right now. Document everything. Work hours, income changes, immigration status. The burden of proof is shifting to you, and you need to have documentation ready. Review your current coverage. Understand exactly what you have and what you might lose. Don't wait until open enrollment in the fall to find out you're not eligible anymore or that you can no longer afford coverage. From a practical insurance standpoint, if you're on Medicaid expansion, start tracking those work hours now. 80 hours per month isn't optional if this becomes a law. It's a coverage requirement. And if you're on Medicare and not a U.S. citizen, gather your immigration documentation. You'll need to prove your status to keep your coverage. And if you get ACA subsidies, be extra careful about income reporting because overestimating is now much safer than underestimating. If you're a lawfully present immigrant, safely check your immigration status category immediately. Asylum seekers, TPS recipients, parolees, and those with deferred action will lose marketplace subsidies. So you need to plan for a full price insurance plan or find alternative coverage. And as for everyone, consider supplemental insurance options, short-term plans, critical illness coverage, accident insurance. These all become more important when major coverage might disappear. And small business owners, look into those choice arrangements because offering competitive benefits without the complexity of group insurance is huge for any prospective employee. The insurance landscape is about to change dramatically. I'll be tracking every development and helping my clients navigate these changes because understanding insurance isn't just helpful, it's how you protect your family when the rules change. If you found this video helpful or interesting, please be sure to like this video and subscribe to our channel for more insurance updates that affect you personally. And drop all of your questions in the comments. I read every single one, and your questions help me create more helpful content. And remember, I'm a licensed insurance broker, and NavaQuote is here to help you find coverage that works for you. Our contact info and a link is in the description to schedule a completely free consultation with me. And after that, click on this video link right over here for my next video so you can stay covered and informed. Thanks so much for watching, and I'll see y'all in the next video.